Hi everyone, my name is Anna and I'm one of the speech pathologists here at Best Start Clinic. I'm here today to give you a brief overview of echolalia and strategies and tips that parents can use at home in response to their child's echolalia. So firstly, what is it? Well, echolalia is the exact or near exact repetition of another person's speech. Children with autism spectrum disorder often present with echolalia, and it is a very common communicative feature in ASD. Typically, developing children also echo language because it is a normal phase of language development. However, if it persists after 3 years old or it's unusually frequent, we call it echolalia, and it's atypical. If they're echoing language before 3 years old, we tend to call it imitation. Well, we do call it imitation. So there are 3 types of echolalia. There is immediate, delayed and mitigated. So immediate echolalia is when the child repeats verbatim, so exactly, another person's speech straight after they've said it. Delayed echolalia is when the child repeats exactly another person's speech, however at a later time, so not immediately after. This is also sometimes known as scripting. And finally, mitigated echolalia is when the child repeats another person's speech. However, it's not an exact or literal repetition. They may change a few words or their intonation. Mitigated echolalia is a good sign of developing language abilities, and it's actually a positive prognostic factor. So to understand echolalia, it's important to think of why children are using it, so its functions. It has many different functions, and they can be divided into 2 categories. We've got interactive functions or non-interactive functions. Interactive functions are used or directed at another person. They may be used for turn-taking, to make declarations, such as labelling objects or actions. Their echolalia may be used when they're trying to answer yes to one of your questions, or to request objects. Non-interactive functions of echolalia are messages for the child's own personal use. So they may include non-focused or unclear functions. This often appears when the child is highly aroused, so they might be very frustrated or very angry, but then echolalia is not necessarily an attempt to self-regulate themselves. Non-interactive functions may also be an attempt to self-regulate themselves, or it may be used as a rehearsal. So their echolalia may be used to aid the processing time of what the adult has said to them or the adult's question. But more generally, echolalia is a strategy used by children to cope with a very demanding interaction, communicative interaction. So how do we help echolalia? This can really depend on the function of the child's echolalia. But general approaches include pausing, letting the child process the question, because they may respond correctly after they've echoed it, once you've given that pause, and then once they do respond correctly, reward them intrinsically or naturally. So continuing that social interaction or giving an appropriate response. You may choose to respond literally. So if they echo your question, for example, you might say, "Do you want some juice?" And they echo, "Do you want some juice?" You could say, "No, thank you, I think you want juice," and then prompt them to say, "Yes, I want juice." You could use a starter or a carrier phrase, sentence. So for example, you might say, "What do you want to drink?" "I want some," and the child would fill in your blanks, "juice." You could, alternatively, you could ask, do you want to drink, yes or no? And the child may echo no, so the last word or phrase that you said. So then withhold the drink and don't give it to them. Act literally upon what they responded. If they do get frustrated or grab or indicate in any other way that they do in fact want that drink, then say, "Oh, want drink, you want the drink." So model that back to them, that correct response. So that is a very brief overview of echolalia. If you do feel that you would want more support, or specific strategies to implement with your child, please speak with one of the speech pathologists at Best Start Clinic, because they can speak to you about the specific functions of your child's echolalia and strategies that would best suit them. Thank you.